Balance training is teaching the body to react to changes in position. For example, when you sway from side to side or forward or backward, your brain and central nervous system quickly turn on the muscles that will put you back in the center. The more you train your balance systems, the better they respond. No one group of muscles control balance. Depending on the movement, your brain decides what muscles it needs to recruit at the moment to help maintain or regain balance. Balance training doesn't have to take a long time. Just minutes a day, added to your current exercise routine, can give results in a short period of time. Improving lower body strength will help you to improve your balance, and better balance means reduced risk of falls. Here are some safety tips for lower body exercise. If needed, hold on to a chair for balance, initially using both hands. To progress, try moving from both hands to only one hand, and then from one hand to only one fingertip. When you feel comfortable using just one fingertip, try the lower body exercises without holding on at all. If you feel steady on your feet, move to doing the exercises using no hands and then with your eyes closed. Again, have someone standing close by if you feel unsteady. Most people think that to stand up straight, you have to heave your chest up and out and then pull your head back into your chest. This is not so. The spine has two natural curves that you need to maintain, called the double C or S curves. These are the curves found from the base of your head to your shoulders and the curve from the upper back to the base of the spine. When standing with proper posture, make sure that your weight is evenly distributed through your feet. You might feel like you are leaning forward and look off balanced, but you don't. Proper alignment places your ears loosely above the shoulders, above your hips, and then again above your ankles. These points make a straight line, even though the spine itself curves in a slight S. Stand with weight mostly on the balls of the feet, not with your weight distributed only through your heels. Avoid locking your knees. Keep feet slightly apart, about shoulder width. Let arms hang down naturally to the sides of the body. Direct your eyes forward to focus on a target with your chin parallel to the floor. Gently move your head straight back until your ears are over your shoulders. Stand straight and tall with shoulders upright. Imagine that the top of the head is being pulled toward the ceiling by a string. There are three strategies to use for postural control. The first is the ankle strategy. The body moves as a single unit about the ankle joints. The upper and lower portion of the body moves in the same direction. This strategy is generally used to control sway when we are standing upright in space or swaying through a very small range of motion. Effective ankle strategy requires sufficient range of motion and strength in the ankle joints, a solid wide surface below the feet, and an adequate level of sensation in the feet and ankles. The second strategy is the hip strategy. The upper and lower body move in opposite directions as a result of the hip muscles being activated to control balance. Effective hip strategy requires sufficient range of motion and strength in the hip region. And finally, the third strategy is the step strategy. When the center of gravity is transferred beyond the maximal stability limits, or sway is too big to use the hip strategy effectively, the step strategy requires a new base of support be established by stepping with your foot and utilizing your ankles and hips in the most effective simultaneous movement. Effective step strategy requires sufficient lower body muscle strength, power, and range of motion, and the ability to move the limb rapidly during step initiation. The core consists of many different muscles that stabilize the spine from the neck and shoulders to the pelvis. These muscles provide a solid foundation for movement in the extremities. And since all powerful movements originate from the center of the body out, the spine must be stable and solid before the extremities can contract effectively. Well-conditioned core muscles can correct postural imbalances and improve functional fitness. That is, fitness essential to performing the regular activities of daily living. The abdominals are often thought of as the major muscles involved in core conditioning. However, they provide only a small contribution to overall core training. The list of muscles that contract and stabilize the spine includes much more than just the abs. Abdominal bracing is the act of stiffening or tightening the muscles of the midsection. The rectus abdominis, the most well-known six-pack muscles, are located in the front of the trunk and allow the spine to flex or bend forward. Sometimes referred to as upper abs and lower abs, it is really one muscle. Different exercises can target more fibers in the upper or lower region of the muscles, but you can't contract either independently of the other. Obliques. Internal and external obliques are located on the side and front of the abdomen and allow the trunk to rotate while they support and stabilize. They will be called into action during rotational movement and during most stabilization. The transverse abdominis is the deepest of the abdominal muscles and located under the obliques. It wraps around your spine for protection and stability and is used to compress the abdomen. A great way to learn to recruit the transverse abdominis is to concentrate on pulling your navel back into your spine without moving your hips or bending. Breathe evenly while contracting. This can be done either seated, standing, or lying. Being able to activate this muscle is key in maintaining a neutral spine during all exercises. The erector spinae are located along your back. These muscles allow the spine to extend or bend backward. To help you return to good sitting posture from forward bending, it's important to include exercises that target these muscles so that there is balance between trunk muscles in the front and back.